Chapter 1 EMS Systems. The text is the primary resource for the EMT course. It discusses what will be expected of you during the course and what other requirements you will have to meet to be licensed or certified as an EMT in most states. You will learn the differences between first aid training, a Department of Transportation EMR training course, and the training courses for an EMT, AMT, and paramedic. EMS is a system. Chapter 1 discusses that system's key components. EMS system consists of a team of healthcare professionals, provides emergency care and transport, and is governed by state laws. As an EMT, you are part of a larger team that responds to a variety of calls and provides a wide range of pre-hospital emergency care. After you successfully complete this course, you should be eligible to take either the National Registry of EMTs exam or your state certification exam. After you pass the certification exam, you are eligible to apply for state licensure. Licensure is the process by which states ensure applicant competency in an examination setting. This allows states to manage who can function as a healthcare provider. In most states, there are 4 training and licensure levels: EMR, EMT, AMT, and paramedic. An EMR has very basic training. They provide care before the ambulance arrives and may assist in the ambulance. Emergency medical responders, such as law enforcement officers, are trained to provide immediate, basic life support until EMTs arrive on the scene. An EMT has training in basic life support, including automated external defibrillation, airway adjuncts, and assisting patients with certain medications. An AMT has training in specific aspects of advanced life support, including intravenous therapy and administration of a limited number of emergency medications. A paramedic has extensive ALS training, including endotracheal intubation, emergency pharmacology, cardiac monitoring, and other advanced assessment and treatment skills. EMT course includes 4 learning activities: reading assignments, lecture presentations, and classroom discussions, step-by-step demonstrations, summary skills sheets, and case presentations and scenarios. EMTs are the backbone of the EMS system in the United States. They provide emergency care to the sick and injured. Requirements differ from state to state. Generally, the requirements to be licensed and employed as an EMT are high school diploma or equivalent, proof of immunization against certain communicable diseases, successful completion of a background check and drug screening, and a valid driver's license. Successful completion of required courses and certification exams. Demonstration of the mental and physical abilities necessary to perform the job. Compliance with other state, local, and employer provisions. The Americans with Disabilities Act of 1990 protects people who have a disability from being denied access to programs and services that are provided by state or local governments. Prohibits employers from failing to provide full and equal employment to the disabled. Title I protects EMTs with disabilities who are seeking gainful employment under many circumstances. Employers with a certain number of employees are required to adjust processes so that a candidate with a disability can be considered for a position and modify the work environment or how the job is normally performed. Personal background in accordance with state criminal requirements. These states have various requirements prohibiting individuals who have committed either misdemeanors or felonies from becoming EMS providers. Origins of EMS include volunteer ambulances in World War I, field care in World War II, and field medic and rapid helicopter evacuation in Korean conflict. As recently as the 1960s and early 1970s, emergency ambulance service and care varied widely in the United States. EMS as we know it today originated in 1966 with the publication of Accidental Death and Disability, the neglected disease of modern society, more commonly known as the White Paper. Emergency Services Act of 1973 created funding sources and programs to develop improved systems of pre-hospital emergency care. The DOT published the first EMT training curriculum in the early 1970s. The American Academy of Orthopedic Surgeons prepared and published the first EMT textbook in 1971. Efforts are underway to standardize levels of EMS education nationally. In the late 1970s, the DOT developed a recommended national standard curriculum. During the 1980s, many areas enhanced the EMT national standard curriculum by adding EMTs with advanced levels of training who could provide key components of ALS care and advanced life-saving procedures. In the 1990s, the National Highway Traffic Safety Administration developed the EMS Agenda for the Future, a document with a plan to standardize the levels of EMS education and providers. In 2019, NHTSA revised the EMS Agenda for the Future and published EMS Agenda for 2050. The levels of training include the federal level, which is the National EMS Scope of Practice Model, provides guidelines for EMS skills. This document provides overarching guidelines for the minimum skills each level of EMS provider should be able to perform. The state level, in which laws regulate EMS provider operations. The local level, which the medical director provides daily oversight and support to EMS personnel. The figure on this slide illustrates the hierarchies of the National EMS Scope of Practice Model. Millions of laypeople are trained in CPR and learn how to use automated external defibrillators. Emergency medical responders include law enforcement officers, firefighters, park rangers, and ski patrollers. EMR training provides these individuals with the skills necessary to initiate immediate care and assist EMTs upon their arrival. The course focuses on providing immediate BLS and urgent care with limited equipment. The EMT course requires about 150 to 200 hours. The EMT possesses the knowledge and skills to provide basic emergency care. The EMT, together with any other EMTs who have responded, assumes responsibility for the assessment, care, packaging, and transport of the patient. The Advanced Emergency Medical Technicians course adds knowledge and skills in specific aspects of ALS, including IV therapy, advanced airway adjuncts, and administration of a limited number of medications. Paramedic Extensive Course of Training includes course hours ranging from 1,000 to more than 1,300 hours and is divided between classroom and internship training. The course may be offered within the context of an associate's or bachelor's degree college program. The training also covers a wide range of ALS skills. The EMS Agenda 2050 outlines 5 components of an EMS system: comprehensive, quality, convenient care, evidence-based clinical care, efficient, well-rounded care, preventive care, and comprehensive and easily accessible patient records. Public access offers easy access to help in an emergency is essential. The 911 system is the public safety access point. An emergency medical dispatch system has been developed to assist dispatchers in providing callers with vital medical instructions until EMS arrival. Mobile apps allow laypeople trained in CPR to be alerted of a cardiac arrest in their area and the location of the nearest public aid. Human Resources focuses on the people who deliver the care. The EMS Agenda 2050 encourages the creation of an environment where talented people want to work and turn their passion into a rewarding career. The medical direction is a physician medical director authorizes EMTs to provide medical care in the field. The medical director is the ongoing working liaison between the medical community, hospitals, and the EMTs in the service. Appropriate care is described in standing orders and protocols. Protocols are described in a comprehensive guide delineating the EMT scope of practice. Standing orders are part of protocols and designate what the EMT is required to do for a specific complaint or condition. Providers are not required to consult medical direction before implementing standing orders. Medical control can be offline or online. Offline or indirect consists of standing orders, training, supervision. Online or direct consists of physician directions given over the phone or radio. Although each EMS system, medical direction, and training program has some latitude, its training, protocols, and practices must follow state legislation, rules, regulations, and guidelines. A senior EMS official is usually in charge of necessary administrative tasks such as scheduling, personnel, budgets, purchasing, and vehicle maintenance, and the daily operations of ambulances and crews. Pre-hospital care should be continued in the emergency department to ensure that the patient receives comprehensive continuity of care. Method of delivering health care that utilizes the pre-hospital spectrum. Mobile integrated health evolved with the goal to facilitate improved access to health care at an affordable price. In the mobile integrated health model, health care is provided within the community, rather than at a physician's office or hospital, by an integrated team of healthcare professionals. This branch of healthcare is causing the evolution of additional training levels for EMS providers. A. Community paramedicine, in which experienced paramedics receive advanced training to equip them to provide services within a community. In addition to the patient care services a paramedic would typically provide, services provided by community paramedics may include performing health evaluations, monitoring chronic illnesses or conditions, obtaining laboratory samples, and administering immunizations. Computer systems are used to document patient care, and this electronically stored information can be used to improve care. The medical director is responsible for maintaining quality control within the EMS system. Adopting a just culture promotes a learning culture that holds employees accountable for behavioral choices by balancing fairness and accountability. Continuous quality improvement reviews and performs audits of the EMS system to identify areas of improvement and/or assign remedial training. Minimizing errors is the goal. Patient safety helps minimize medical errors that occur as a result of a rules-based failure, a knowledge-based failure, or a skill-based failure, or any combination of these. This requires the efforts of both the EMS agency and EMS personnel. Finance systems vary depending on which organization is involved. Personnel may be paid, volunteer, or a mix of paid and volunteer. EMTs may be asked to gather insurance information from patients, secure signatures on certain documents such as HIPAA notifications, or obtain written permission from patients to bill their health insurance company. In 2020, the Centers for Medicare and Medicaid Services implemented a pilot program called Emergency Triage, Treat, and Transport. ET3 strives to reimburse EMS systems for providing the right patient care at the right time. Set up a payment model for patient transport to alternative destinations, such as urgent care centers or doctor's offices, or on-scene treatment with no transport. EMS instructors are licensed in most states. Most EMS training programs must adhere to national standards established by two accrediting organizations: Committee on Accreditation of Educational Programs for the Emergency Medical Services Professions, COAMSB, and Commission on Accreditation of Allied Health Education Programs, CAHEP. Frequent continuing education, refresher courses, and computer-based or mannequin-based self-education exercises are measures intended to maintain and update an EMT skills and knowledge. Prevention and public education includes aspects of EMS where the focus is on public health. Public health examines the health needs of entire populations with the goal of preventing health problems. EMS works with public health agencies in two ways. Primary prevention focuses on strategies that will prevent the event from ever happening. For example, educating the community on pool safety and car seat installation, and secondary prevention occurs after the event has already happened. The question then is, how can we decrease the effects of the event? Helmets and seatbelts are examples of secondary prevention. The table on this slide lists examples of public health accomplishments. EMS research helps determine the shape and impact of EMS on the community. Evidence-based medicine focuses on procedures that have proven useful in improving patient outcomes. Many EMS systems and states consult the National Model EMS Clinical Guidelines from the National Association of State EMS Officials. Guidelines are based on a review of current research and expert consensus. EMTs are healthcare professionals, whether paid or volunteer. The roles and responsibilities of an EMT: keep vehicles and equipment ready for an emergency, ensure the safety of yourself, your partner, the patient, and bystanders, be familiar with emergency vehicle operation, be an on-scene leader, and perform an evaluation of the scene. Call for additional resources as needed. Gain patient access. Perform a patient assessment. Give emergency medical care to the patient while awaiting the arrival of additional medical resources. Give emotional support to the patient's family, and other responders. Maintain continuity of care by working with other medical professionals. Resolve emergency incidents. Uphold medical and legal standards. Ensure and protect patient privacy. Give administrative support. Constantly continue your professional development. Cultivate and sustain community relations. Give back to the profession. Professional attributes: integrity, acting consistently, maintaining a firm adherence to a code of honest behavior; empathy, being aware of and thoughtful toward the needs of others; self-motivation, discovering problems and solving them without someone directing you; appearance and hygiene, using your persona to project a sense of trust, professionalism, knowledge, and compassion; self-confidence, knowing what you know and knowing what you do not know; being able to ask for help. Time management, performing or delegating multiple tasks while ensuring efficiency and safety. Communications, understanding others and making yourself understood to others. Teamwork and diplomacy, being able to work with others, knowing your place within a team. Communicating while giving respect to the listener. Respect, holding others in high regard or importance. Understanding that others are more important than you. Patient advocacy, constantly keeping the needs of the patient at the center of care. Careful delivery of care, paying attention to details, making sure that what is being done for the patient is done as safely as possible. Most patients will treat you with respect, but some will not. Yet every patient is entitled to compassion, respect, and the best care you can provide. As healthcare professionals, EMTs are bound by patient confidentiality. Patient privacy must be protected. Findings or disclosures made by the patient should be discussed only with those treating the patient in limited situations, as required by law, with the police or other social agencies. Protection of patient privacy has drawn national attention with the passage of the Health Insurance Portability and Accountability Act.